Welcome to today's Religion Media Centre briefing, which is on the subject of the cost of living and mental health. And we're basing this on a report that's come from Christians Against Poverty, which is warning that the cost of living crisis is causing mental health problems and drawing parallels with statistics for depression and anxiety and delving into the exact repercussions of that on people. But to join us in the discussion, we have Gareth McNab from Christians Against Poverty. Gareth, you're the Director of External Affairs. So you're joining us, and also Paul Morrison from the Methodist Church, Policy Advisor at the Joint Public Issues Team, which represents the major free church denominations, and Tom Pollard. Tom, you were a consultant who wrote a report for the Joseph Rowntree Foundation called Push to the Edge. This was on food banks and poverty. So there'll be a chance for the three of you to engage in a conversation later, but perhaps if I could bring you in one by one to walk us through the facts and information about this. So we'll start with you, Gareth. This is your report from Christians Against Poverty. Just tell us something about the report, first of all. I know that you write an annual report based on information that you glean from your clients. Tell us how big you are, how big is your client base, and how many people responded to the survey, and so tell us something about how you collected the data.
Great, thanks very much, Ruth. I should highlight that the cost of living crisis is not the particular thing that instigated the research here. This is our annual client report. It's an annual survey of our clients who sought help from us during 2021, supplemented with data from clients on our database who've joined us in the years previous that we're still helping get debt free. But you can't release a report into the ether at the moment without needing to reference the cost of living crisis. And so while the report itself doesn't necessarily anchor on right now, this minute inflation running rampant and so on, which we'll comment on later, I'm sure, in discussion. I think the main gist I'm trying to get across is the cost of living crisis that everybody knows about and cares about now has been a reality for those on the lowest incomes for many, many years, actually. And that the mental health impacts and so on that we're discussing here have been a reality for people on the lowest incomes for many, many years. My hope is that insight shared on this call today brings to life a long-standing reality, and that we're able to move the needle on how wider society appreciates the issues that those on the lowest incomes are addressing. Your specific question, Ruth, the methodology is in our report. So the report is titled On the Edge. It's our client report. I'm sure there'll be links coming soon. I'm not sure whether that's mirrored properly on the screen. But you asked a specific question. Data's been gathered from 750 responses to our annual debt help survey. That survey went out during October last year and was received back in December. And that's a really helpful health check in terms of the issues that I'm outlining here predate the energy price cap increase in April of this year. They predate inflation hitting double digits in March of this year, and the undershooting of the uprating of Social Security, matching inflation last year, not inflation this year. And so basically every number I tell you out of this report, make it worse, because that's what's actually happening today. We've done some pulse surveys with clients, smaller groups throughout the year, and we're looking to try and understand how out of a relatively benign economic environment where you can do an annual survey of your clients, and that generally stands true-ish for the coming year. In the current inflationary environment, questions you asked people 2 months ago are less easy to apply in another 2 months' time, because that's the difference. Double-digit inflation makes a lot of these things harder.
I was going to ask you about that, actually. How frequently will you do this survey during the year because of all the changes that are coming down the line?
So the survey that we've done here, we are committed to do annually and have been publishing for many, many years. They're on capuk.org/policy and governance, or policy and government. I'll make sure Joe Beardsall, our PR officer who's on this call, will be able to send links to you, Ruth. We commissioned the first pulse survey of a smaller group of clients in May. That dug into some of the details. So when I share with you some of the rationing behavior clients have been showing in terms of reducing use of food and fuel and energy, trying to pick up on what's changed since December. Some of that insight is we have to understand to get a quick answer out of a group of people who you actually worked really hard to survey both in print and digital, to make sure it's representative of our entire client base. To get quick responses, you end up with smaller samples, and the survey, the pulse survey we put out in May, was digital only. And so there's some self-selecting bias. So some of the numbers they're interesting for insight, but they're not necessarily numbers that we're going to be publishing as because they'd be an apple with an orange. I don't ever want to compare an apple with an orange. But the insight that it suggests, for example, the 25% or so of our clients have been rationing their eating or their heating on at least a weekly basis at the tail end of last year. While that number of the whole base hasn't changed, in May when we asked, it's nearly 67% of the lowest income households have been rationing either food or fuel on at least a weekly basis.
And so this was before all the events that you've just been describing. Yep. So even before inflation and before the fuel hike, people were still rationing their food and heating. Can you just give us some examples? I mean, how many meals were people missing? How many days were they going without heat?
So your question's brilliant, Ruth, because it plays to the point that I've been making. Inflation has been a problem for people on the lowest incomes for more than a year. When you look at the actual bit of the household budget that people on the lowest incomes are spending and what they're spending it on, while inflation hasn't been affecting the discretionary purchases for many of us for some time, Sorcha, yes, it is. I'll ask Joe to send the link. While inflation on discretionaries hasn't really been moving until the war in particular really started to bite. Inflation on energy prices, when the energy price cap went up in October of last year by between 12 and 14%, that didn't really dent my household finances. Inflation for me and my house would have been around about 3-ish%, which is where CPI was September to November last year. But for a household that's spending more than 10% of its disposable income on energy, they're overly exposed to that price rise that was 12%. So inflation was nearing double digits for some of the lowest income households. One of the challenges we have is that those people who keep track of those statistics haven't necessarily been focusing on right across the income deciles and right across the different bits of the shopping basket. The media have tended to show an interest in the CPI shopping basket, the consumer price index, the leg of lamb and the bottle of deodorant. When you get into what actually happens on 4 pints of milk and a couple of bags of pasta, that's where you see the inflation really biting. So what was happening? So we asked the question, to what extent were you rationing food or energy or lighting on a monthly basis? And then we asked fortnightly, and then we asked weekly, then we asked daily. For those, when it comes to meals, 7%, 15% were going without meals on at least a weekly basis, and 11% on a daily basis. When it comes to heating, 12% were going without energy on a weekly basis, and 13% were going out without on a daily basis. Remember, this survey was answered in the winter. So in the most recent winter, 13% of my client base were going without heating on a daily basis and 12% on a weekly basis.
And your client base, are they all on universal credit? Just tell us about some stories about the people that you work with. Is there a kind of average amount of money that they have per week, an average profile?
Yes, there is. We have some percentages of the number of clients who are reliant on Social Security. And I'm finding that for you. 89% of the clients who approached us last year received some form of income by way of Social Security. 42% were entirely reliant on Social Security for their income.
Yeah, I thought that was quite an interesting statistic, because that means 58% are working. So amongst the hardship that you've reported, these are in working households.
And I would also challenge that in that Social Security covers all of the benefit systems. So it includes pensions, it includes that which we would normally call benefits. But of course, universal credit is an in and out of work benefit. So being on universal credit doesn't mean that you're on what used to be job seekers allowance. It means you could be in work, but on such a low income that you need to be subsidized by the Social Security system. So the majority of our clients would be capable of some form of work. We don't really get too much into whether you're in work or not. It's your position in the survey, at least. It's your position in terms of receipt of Social Security, because the policy issues that we'd want to challenge out of these statistics are getting people out of debt is hard enough, except it's almost impossible when incomes are substandard. So when 42% of people are entirely reliant on Social Security, and 43% of those have that social security deducted at source by the government to repay so-called debts. That's a problem that debt advice can't solve, because if income is less than expenditure and income is then reduced further to repay debts without assessment of affordability, then we can be arguing about in or out of work. But the government being one of the most forceful debt collectors in the nation, and not bound by the regulation that they insist that financial services and other regulators bind energy, for example, to, and then we have some deep systemic challenges.
Those statistics are harsh enough, but the headline coming out of it that you've put on your media reports about it is the headline about mental health. Yes. Mental health becoming worse with the debt that people fall into. And you've got this stark number here that 36% of those that you help have attempted suicide because of their debt problems. How great a rise is that from previous studies that you've found? How alarming is it?
Yeah, so for clarity, it's 36% said that they had considered or attempted suicide as a way out of debt. That has gone up from, I think it was 28% last year. Joe will verify. It was only 28% last year. I mean, that's ridiculous, isn't it? Around 1 in 4 of our clients last year. And it's got worse to 1 in 3. It's especially alarming because of what it should be describing about the experiences of people on the lowest incomes and in problem debt. In the other numbers in the report that describe the typical delay between first experiencing a problem and then seeking free debt help to resolve that problem. More than half of our clients were waiting more than a year before they came forward to us for help. And when we asked them what the reasons were, the first one was, I felt like I should have been able to sort it out myself. That's a way of describing the social pressure on us to be self-reliant or atomized individuals in society. The other descriptions they give are, I felt ashamed, I felt guilty, I felt fearful. And that describes what the stigma of debt and poverty feels like when you're on the receiving end of it. If you're white and male and middle class, or if you're just generally British and you do the stiff upper lip, we don't talk about money, sex, politics, or religion. I appreciate this briefing. We probably do talk a bit about some of those things. The way that society works, where it's a shameful thing to talk about money. We don't talk about it as a wider society. That's all well and good for me, but the culture that creates is one that generates fear, stigma, and makes people delay seeking the free debt help that can be the beginning of them getting free from that. I think that the other bit that I draw out here is while it's a newsworthy increase in suicidality among the client base that sought help from us in 2021 compared to the ones in 2020. In 2019, it was a similar level, a little bit lower than it is now. The question was subtly different. And so it's not quite apples with apples, but it was mid 30% of people who sought help from us in 2019 described that they were experiencing suicidality. So what's happened there? During that time, we experienced a global pandemic, which lots of people would have predicted might have increased mental health difficulties and suicidality. And in some parts of society, it would seem that it did. But remember the proportion of my clients that were reliant on social security. And remember what the Chancellor did when he gave £20 a week extra. And we as campaigners called it a lifeline. When we argued that it should not have been removed under any circumstances, when we tried to explain what that £20 a week meant in terms of the dignity of standing in a queue in a supermarket rather than the shame of standing in the queue for a food bank. Not that there should be any shame in seeking help, but it's what users of food banks describe. When we tried to describe that £20 a week was literally a lifeline, this is what we were warning people of, that you take that money away and people will feel alone and desperate and with nowhere to turn to. And when you're in that kind of circumstance, suicidality will be quite common. I don't want to get too far into it because Tom's way more expert in this than me. But this is one of the links that I would be asking people to just track, is that we've seen an increase in the rationing behavior from the essentials, and we've seen an increase in mental health difficulties and suicidality. And the timing correlates exactly with the withdrawal of just £20 a week for the lowest incomes households in society, recognizing that those people on legacy benefits weren't in receipt of that, and they should have been.
I should just add at this point that the Samaritans couldn't be with us today, but they have asked us to point journalists towards their guidelines on reporting suicide, where they say speculation about the trigger or cause of a suicide can oversimplify the issue and should be avoided. So they would caution against saying it's because of the cost of living that more people are thinking of or are attempting suicide. It's always more complex than that, is what they were saying, just to add that. Paul, Gareth, thank you very much indeed. Can I move over to Paul Morrison now? Paul, you're policy advisor at the Joint Public Issues team, and you're with the Methodist Church. I know that all of you all work together on these kinds of issues, but does Gareth's story resonate with what you're finding as well in your work?
Yes, we did quite a lot of sort of focus groups with community leaders around the country at the sort of starting at the beginning of the year, because we realized that something was happening. And one of the key things they said agrees very much with what Gareth was saying, which is that the cost of living crisis isn't a crisis in isolation. It's a crisis. There has been 10 years of austerity, and then there has been 2 years of pandemic, both of which had disproportionate effects on the poorest in society. And now we're moving towards people, this cost of living crisis in which, again, as Gareth says, the experienced inflation rate for the poorest is higher than the average inflation rate. And that's because they spend more money on food and on fuel, and it's food and fuel that are going up. So our best estimate is that for people in the bottom fifth, their experienced inflation rate is around about 14% now. And inflation rates are individual, and I think IFS comes out with about 12%. So the context of these crises following one after each other is one that we see. And I think the thing I really want to reinforce in what Gareth has been talking about is that the social security system is failing. It is failing to provide the support that people need to just live and live with a certain amount of dignity. So within Trussell Trust, their data is saying that 50%, our Food Foundation says that 50% of universal credit clients are food insecure. So they're having to ration food. 1 in 6 universal credit clients visited a food bank between December and February of this year. That's an extraordinary fact, and that if this is a system that is meant to protect people from destitution, and 1 in 6 of their clients needs to visit a food bank, it's not working. It is failing to do that, and that's really important.
But it's I remember when the £20 was withdrawn, and there was a big campaign from all of you, lots of pressure groups to ask the government to keep the £20, and it didn't happen. Yeah. Is the answer simply, do you think, to go back to the government and say raise universal credit by £20?
That would be great if it happened, but the answer is actually universal credit was designed with an idea that by using, it's a complex system which is designed to incentivize work, is the phrase. So it's designed with this concept that if you give a gradation of payments, then people will move out to work. The thing is, it hasn't worked. We've done that experiment for about 10 years now, and we now know that this complex gradation doesn't actually move more people into work. So, and there's all sorts of reasons for that. But what it left behind was the fundamental principle that the benefit system should provide you with enough to live. And what needs to happen is that principle needs to be reinserted. So yes, £20 a week will make it closer to what people need to live. But actually what we should do is look at our benefit system and decide if people can live on the money that it provides. And if they can't, and if it can't, then we need to change the benefit system.
Right. Okay, thanks, Paul. I'm going to bring in Tom Pollard now. Tom, you're a consultant who wrote Pushed to the Edge, Poverty, Food Banks and Mental Health. And that was a report for the Joseph Rowntree Foundation. Can you tell us something about how you did your survey? Because one of the towns that you went to when you looked at food banks was Sevenoaks, which must be one of the richest towns in the southeast commuter belt. What did you find there?
Yeah, so it was a very qualitative piece of work. So the idea was, I guess, as a kind of complementary piece of work to the type of report that Gareth's talking about today, which is, talking about lots of people who have access to service. This was talking to a small number of people, but in a lot of detail about the circumstances that had led them to need a food bank, and in particular, the impact on their mental health. I'm a researcher, but I also work in mental health services as a social worker. So I was able to have quite kind of in-depth conversations about that personal impact. And this was in sort of November, December last year. So in the similar period around the time just after the cut. And as you say, one of the food banks was in Sevenoaks, one of them was in South London. I think if you go to any part of the country at the moment, you'll find people, even in very wealthy areas, that are struggling. People who, particularly during the pandemic, found themselves in kind of surprising situations, people who had never expected to be on benefits. And that was certainly more of what I heard in Sevenoaks, people who said, I never thought I'd be on benefits. One guy even said, I've donated to a food bank in the past. I never even, imagined that I could end up needing support from a food bank. So there was maybe a slightly different experience there, and people maybe being newer to that kind of need. And the food bank itself was certainly newer. But there were lots of universal issues. I mean, the reason people were needing to go to food banks, often it was some sort of initial shock, like a benefit sanction or having to wait for their first payment on benefits. But what a lot of people I spoke to found was that even after they got over that, individual financial shock, benefits were just inadequate to meet their sort of day-to-day and week-to-week needs. And these were all people on universal credit. It was just after the cut had happened. And actually, to support what Paul just said then, a lot of people said, yes, the £20 cut as it was experienced then was a big shock and made things harder. But even before that cut happened, it wasn't like they were finding it easy to make ends meet. And most people I spoke to said, you'd need an uplift maybe three or four times of that amount. So you'd be looking at kind of adding maybe 40 or sort of 40 to 80 pounds a week onto universal credit before people felt they'd sort of be able to comfortably make ends meet. So I think I'd support Paul there, that there is just a fundamental issue of adequacy here. And until you get beyond that, a lot of the other things you're doing are kind of sort of fiddling around the edges, because ultimately there are lots of people out there who can't afford to meet all their costs.
One of the interesting things I picked up in your report was when you said that food banks are now so widespread and so well used that they've become institutionalized. People couldn't survive without them, and that's obviously something else that you found in your report.
Yeah, and I think you kind of hit a problem there because to some extent the impact of what would be happening without food banks there is kind of hidden. So the kind of true impact of the destitution that's being caused by the inadequacy of the social security system kind of gets mitigated slightly and hidden a little bit from sight. We still see a lot of that kind of bubbling up within mental health services, but I think we'd be seeing many more horror stories in the media if there wasn't this kind of shadow safety net below the real safety net. And I mean, certainly in terms of the impact on individuals, what I heard was that many people who already have mental health problems found that their kind of financial difficulties are making those problems a lot worse. There were many people who didn't have mental health problems before, but as a result of the financial problems they were facing, had developed mental health problems. And then other people I spoke to who didn't describe themselves as having mental health problems, but certainly from what they said, there were lots of clear signs of poor mental health. So really struggling with sleep, worrying all the time, sort of physical manifestations of poor mental health. And for me, the most profound thing was just how consumed people were mentally with the day-to-day challenge of sort of trying to scrape together a living, particularly when they had a family and children to care for. It was all people thought about, how to kind of make every penny go as far as possible. And so the idea that kind of somehow people are kind of squandering their benefits or kind of being inefficient with that money. It just did not ring true at all. In fact, it was the complete opposite, that people were so consumed with that thought and that idea that it made it very hard for them to look beyond today, and very hard for them to kind of take steps that might help them kind of build a better future, because everything was about survival.
You work in mental health, you've just been saying, and Gareth was saying at the beginning that, people who are engaged in that work, Christians Against Poverty and debt advice, also come across people who have more mental health issues because of their situation. So how can the people who are on the front line helping with debt advice or food, giving up food in a food bank, what do they do when they're confronted with somebody with mental health? What advice are they given as to how to deal with people who present with issues like that? Tom?
So the food banks I visited seemed to have quite good connections and understanding of kind of what other local services were available. And certainly the one I went to in London, where I think there were quite a lot of people visiting that food bank who had mental health problems. The staff seemed to be really good at picking up where someone might be struggling. They had other services co-located in the food bank, so like a citizen's advice member of staff was there. There were people attending some weeks from local mental health services. So I think, using that as an opportunity to engage with someone and think about what other support might be helpful to them is critical. For many people, going to the food bank and having at least that point of social contact each week was a big part of their lives. That their lives have been kind of reduced to such a small size by their kind of financial constraints that actually, going to a food bank, even if it was just for a short period, meeting someone, having a conversation, that was a big part of their week or their month, or however frequently they went. And so it is a real opportunity, but it's a shame that it's having to reach that crisis point before we're getting that opportunity to engage with someone. And that speaks to a lot of the kind of degradation we've seen at a local level of kind of community infrastructure, community services that might have picked this stuff up earlier on before it's reached this crisis point. And critically, before it reaches the point that people are having thoughts about things like suicide, because that is when you will have kind of emergency mental health services having to step in and get involved. But ideally, you'd want to pick that stuff up earlier on.
Thank you, Tom. Can I go back to Gareth then here? Because you are called Christians Against Poverty. I'm just wondering that this, what Tom was saying there, just picking that up about involvement in the community as a way of helping people with mental health issues, is that all part of work? Just explain to us the process. What would happen? You have a person who's a mentor meeting somebody who needs debt advice because they're slipping into debt. What happens then? What does the conversation go like when you're dealing with someone on the front line like that?
First of all, would be to acknowledge that we're a debt advice charity who provides some other services and in partnership with local churches around the UK. We're not a mental health charity, and I am not a mental health professional. But we can all do something, is the point. That's the big message I've been giving yesterday when releasing this report at the House of Lords, and today when meeting with a number of our frontline staff. We can all do something to address poverty and its consequences in our communities. It's probably most helpful to describe the Christians Against Poverty service. So when somebody realises that they need the free debt help, and they contact us on 0800 328 0006, and the first thing that happens is a telephone conversation that doesn't just stick numbers in a spreadsheet, but a human being who listens to a human being describe their pain. It's most important to us that the first point of contact with us, people experience a listening ear and kindness, because with the level of isolation and loneliness, withdrawal from society, numbers of our clients haven't experienced that in quite some time and haven't necessarily had the resources to show much of that kindness to themselves. After that, the first meeting with the client, our debt service is a face-to-face service, almost entirely in clients' own homes. Somebody from the local debt centre, along with their befriender, will visit the client in their home and describe our service to them. Explain why we partner with local churches around the UK. It's the single best way for us to ensure that a face-to-face service that acknowledges poverty and problem debt in its full orb nature that recognises that debt is never just a numbers problem. There's always something else going on. It means we can see empty fridges, we can see bin bags full of bank statements. It means we can see somebody flinch when the doorbell goes and pause our conversation and acknowledge that that's a hard thing and maybe a greater priority for the individual to address than necessarily the debt.
What would be the kind of unique thing or the different thing about going to you as an organisation as opposed to a secular organisation? I mean, would people have to already be associated with a church? Would you expect them to join a church?
Great question. So there's a number of things that are relatively unique. So one is our funding base. While we receive some funding from the financial services industry, as a number of debt advice organisations do, it's very, very little. It was sub 600,000 last year. Our charity accounts are public record, and we received some aspect of government money from the Money and Pension Service, most recently to support the provision of debt relief orders. 2/3 of our clients pursue an insolvency route rather than a repayment route, which describes the plight of the lowest income households in the UK. Our funding base means that more than 80% of our funding coming from individual givers and individual local churches who are committed to our work means that the fact that face-to-face debt advice provision is the very most expensive way you could do it. But it's what many people in local communities need. It's what those on the lowest incomes who have been experiencing the mental health impacts around poverty, problem debt, persistent low incomes. It's that they need. When debt advice can see an empty fridge, and we can go and fill that fridge because we don't have to account to a government fund or a financial services funder for that. That's what our individual donors and church donors wanted us to do with their life-changing donations. So that's probably one of the unique things. The other one would be we are Christians Against Poverty. His name's above the door. Jesus is our why, and the church is our how. It's relatively obvious who we are. Because we acknowledge the full order impact of poverty, problem debt, persistent low incomes, we offer to pray with our clients. That offer is freely given, and if it's declined, that decision is freely accepted. The benefit of meeting face-to-face with people from the local church is that loneliness and social isolation that can be the beginning of the slippery slope into deeper and darker mental health impacts is something that we can offer people a way out of. And so we call them befrienders, the often volunteers who go along with our trained debt coaches. Somebody to talk to about something that isn't necessarily the debt stuff. Somebody to maybe pass the time of day with over a cup of tea next week in between debt advice sessions. Actually, that plugging people back into community and beginning to repair the social isolation that they've been experiencing, whether that's traditional church services or it's the community that gathers around local churches in cities and towns and villages right around the UK. That's especially unique. It's not a service that any other advice provider offers, but it's one that we joyfully, gladly do as Christians Against Poverty in partnership with the UK Church.
Thank you. So Paul and Tom, I'd like to ask you what happens next. So you've sketched out for us where we are at the moment and the reasons that you see for our situation. But as we see, fuel costs will begin to bite when the sun goes in and winter comes and as inflation rises. What is going to happen next? How are your organisations gearing up to cope with what's around the corner? Perhaps I can start with you, Paul, and then go to you, Tom.
In terms of what's next, is we've been doing some work with a number of others on trying to understand the potential impacts of cost of living on the increases and also the cost of living payments that the Chancellor announced late in May. And those payments are going to be a buffer, but what they do is buy time. Come the second increase, which will sort of happen at the end of September, there is going to be real problems that people's budgets are going to run out of road. And we are campaigning quite hard and trying to work out and talking to people in power in an attempt to get them to understand that this is the situation we are in. And I'm sure other organizations are doing that too. One of the things that I think is really important is that, and it's quite technical, but it is really important, is that index linking of benefits, we've been told it's going to happen. Now, it didn't happen for a large part of the last decade, which is one of the reasons why benefits have got so low, but we've told it will happen next year. The thing is that it will take the September inflation rate and apply it the next April. But the second increase in fuel happens in October, which means that there'll be no compensation in benefits for that second increase. And that is an enormous amount. I've been talking to sort of people in various projects about the country, and you ask how they're going to cope. And there's also, you get all sorts of, some people are quite up for it and are up for the task of economizing further and further and further. And some people feel quite sort of down. But it is universal when I say that your bills are likely to go up by slightly more than they did in April, in October.
Yeah, no,
when you say that, people just look, I've no idea what to do. I'm lost.
Martin Lewis, who's become this financial guru, was saying that we've completely run out of road now. He doesn't have any more advice for people who are in poverty and can't make ends meet. Is it that bleak? Have we run out of road, I suppose, is the question, Paul?
I think we haven't run out of road because actually we're quite a wealthy country where our economy up until probably last month was still continuing to grow. There is money in this country. We actually, bizarrely, there's forced savings over COVID of about 140 billion more in the bank that people have because they couldn't go out and they couldn't spend and they couldn't do all sorts of things. There is lots of money about. Some of it just has to go to those who had the worst pandemic and those who had the worst decade. And we need to work out a way of doing that fairly. So there is a lot of road to have, but we have to accept that there needs to be a bit of redistribution and a bit of moving about of costs and expenses.
Well, one question for you, Tom, is the volunteers who are providing this safety net for people, can they cope with the increasing demand? I mean, are food banks running out of supplies? Are they running out of energy or motivation to help?
I don't think running out of motivation, but certainly I think the Independent Food Aid Network, who I worked with on the report along with JRF, certainly are reporting that lots of food banks are struggling with supplies, because I think everyone has that sense now of feeling the pinch and needing to cut costs, and so the risk is that even people with more money to spare and people who are more able to kind of take that pinch a little bit and survive through it may still feel like they can't, donate in the same way that they used to. So lots of food banks are talking about supply issues. Lots of the staff at the food banks I visited had previously had used the food bank themselves in the past, and some of them still were using the food bank, but also volunteering. So I think there is an issue around kind of their resilience and their ability to kind of just absorb all of this and absorb all of the stress that the people they're supporting are feeling. And I think, as Paul said, the kind of additional payments that were announced last month, I think it will help, and I think in some ways it was probably more substantial than many of us were expecting. But the real issue is that it kicks the can down the road, and we still haven't really addressed that central question of whether benefits are adequate. And all of this, really, a lot of the kind of measures that have been announced maybe just about get us back to where things were in terms of balancing that, the increases due to inflation. But benefits weren't adequate before all of this started. So it's not like we want to get back to a situation where we were just before the pandemic. Benefits for people who are unemployed are at their lowest real-term rates since the early 1990s. So we are at a real low, and what we need is a more fundamental review of whether the support people receive is adequate, not just to kind of make ends meet, but actually to give people enough of a foundation that they can then build from that. Because the problem is that if you're only ever giving people enough to scrape by, then they're always trapped in that cycle of being consumed by that battle to make ends meet, and they're not ever getting the kind of mental space, but also the kind of financial resilience to actually take progressive steps forward and think about whether work might be possible or whether they can increase their hours, because that stuff is just crowded out by the day-to-day stress of scraping by on such a low income.
Thanks. Going back to you, Gareth, it's another round of questions that everyone on the call, if you'd like to ask a question, just put it in the chat box. But Gareth, can I ask you, what are the signs of hope that you can see that the government has understood through all your representations what is around the corner, and that they have some actions to mitigate this disaster that you see happening?
Great question. When in February, when the Ofgem announced the energy price cap that was going to hit in April, and on the same day the Chancellor announced the council tax rebate and the energy rebate, the criticism from us and many other policy advocates was, this is fast and broad, but it's not targeted, and it's definitely not sufficient. So it just wasn't good enough. It was a lot of free money, but it seemed it just was insufficient. The support that was announced in May, that of the £650 for those on social security, on recessive benefits, the extra money for pensioners, the extra money for those who are disabled, was just as fast and more targeted. So it's hard to say you did a wrong thing, government. They did a right thing. They listened and they responded, and for that we should communicate some kind of appreciation. But the flat rate nature of the grants being offered, while that helps with pace, it means we don't have to do further means testing, and in time the lowest income households don't have. They will freeze and get ill and get sick and die. It doesn't make any difference between my household with 3 children in it and somebody else's household with no children in it. If you're on universal credit, you will get £650 in 2 lump sums, one in July and one a little later in the year. So it doesn't acknowledge the actual costs borne by the lowest income households through this cost of living crisis. That also means that the £1,200 total support that the Chancellor was proud to announce, that if you add the extra £650 of support or so, technically covers the gap between the energy price cap in October 2021 and the energy price cap in October 2022. The challenge with that is that when stated in cash terms, that the energy price cap will have gone up from around £1,600 or so October last year to nearly £2,800, £2,900 in October this year. That's for a typical household with typical usage. Households with a large number of children, households with people who are home during the day, which includes people who have long-term health challenges or disabilities, have higher than typical usage. And people in the private rented sector have lower than typical energy efficiency appliances in their property or insulation in the home, and the total inability to make any changes to improve that efficiency. And so while the Chancellor will have gone away feeling like he's done something sufficient and that he's listened, he hasn't done enough. There are groups in society for whom the support isn't enough. Now, if he listened to us once, your question was, Gareth, where is their hope? My hope is if he listened to us once, there is a chance he may listen to us again. He doesn't have long to respond to our calls, that you need to be ready to deliver more help before October, particularly for those households that the help you last gave wasn't sufficient, because while it was fast and targeted to people in need, it wasn't tailored to the needs they actually have.
Well, signs of hope from you. What signs of hope are there? What targeted campaign will you be taking part in order to change things?
I've put in the chat our briefing on cost of living, and there'll be, hopefully in the next week or two, there will be an update to that, which will include a breakdown of numbers. We've been working with a university to try get a number, Loughborough University, to try get a number to work out how those gaps between need and what was offered, what they are. And I'd really reinforce what Gareth said. One of the things about the way in which the money was given out was that if you were just on universal credit, so you're getting maybe £100 a week, £100 a month or something like that because you're earning, you get 650 quid. If you've got a family that you're looking after and you've got huge needs, you still get 650 quid. And that really means that those families with greater needs were left behind. So we're trying to sort of enumerate that and explain that a bit better. And then we're trying to work to build a coalition around an ask, and that will take a few weeks, I would have thought. But
a coalition of political parties or campaign? A
coalition of campaign groups. I think the political parties' lines are fairly well drawn. I think what we need to do is actually just highlight what the need is and what the effect of not meeting that need is. And for me, yeah, we have to draw drafts and we have to do maths, but it's the stories like Tom tells in the qualitative research and that churches tell to each other and to other people is what changes minds. The fact that, just the fact when you look in the whites of the eyes of someone who has made the decision. I mean, I talked to a single dad who tells his children when they're visiting that he eats late on at night. He does that because he doesn't have enough money to feed himself and the children. So he tells them he'll eat after they go to bed. When you look in the whites of somebody's eyes who says that to you, change is needed. There's nothing, you cannot come away from that conversation without realizing change is needed.
Thank you. Tom, just to wrap things up, you are working in the field of mental health. From the report that we've been looking at today and the impact of the cost of living crisis on mental health, I wonder what changes you would like to see perhaps in your area of work to tackle the increasing need for people to help those with mental health issues.
Yeah, I mean, I think what we need to see is a much broader and more holistic understanding of what leads people to become unwell, and what contributes to people remaining unwell. Because actually, mental health problems can happen to anyone, and mental health problems happen for a whole range of reasons. But for a huge number of people I see in services, it's because of things like poor living conditions, stressful home environments, and a lot of that links back to poverty. It's a huge driver of poor mental health. And while the government is very keen to talk about its commitment to mental health services, I think we need to see much more of a recognition of the kind of interconnectedness of all of this. That actually, if you're only giving people enough money to kind of scrape by, of course, people are going to lack resilience when it comes to dealing with difficult situations like the pandemic or like the cost of living crisis. So I think the government needs to get serious. Essentially, that if they do care about mental health and the impact of mental health problems, then they need to be looking at how the whole of government impacts on that, rather than just thinking about it in terms of the NHS. And similarly, within services, often it feels like there's only so much we can do to support people who are living in such difficult circumstances. We can try to get people additional support, but often it is quite piecemeal, it's quite ad hoc. And so a lot of this can only really be solved at a systemic level. We can kind of patch things up on the ground and try to help people to cope with what they're experiencing. But there is only so much we can do within the NHS to address some of these issues.
Thank you. And thank you to all the panelists for taking part today, and to everyone who joined the call. Please join us again next week for another media briefing. All the best.